Thank you, Stephanie, for that information. I appreciate it. What I would like to do is reiterate some of the frustrations I heard you say, and then also tell you about how we got to the program that we utilize and what that program looks like. So first off, you mentioned building relationships with the treating physician is important to you. You want to know that the treating physician understands the jobs that you have and understand what it takes to get them back to work. And then also, you mentioned communication, how you're not exactly getting calls from a doctor. And if you do have to contact that treating physician, you can't always get a hold of them. And you don't always get the restrictions in a timely manner, causing delays in getting those people back to light duty jobs, correct? Okay, great. Well, I just want to tell you, you're not alone. That is common. What we did to get to our program is we went out to clients like you and just asked you what I just asked you. What's important to you in an occupational health program? We got a lot of inconsistent answers. They were great data. It was great data. We just couldn't pinpoint the features that made it best in class. And then we went to groups like a Voice of a Customer, where we brought in several clients and let them discuss what those features look like. Again, not getting the most consistent answers. So we turned to the experts. We asked them to come up with what are the features of a best-in-class program. So we turned to the American College of Occupational and Environmental Medicine. We also used the AMA and some white papers. What they came up with, and again, it wasn't our work, it's their work, is these 10 must-haves. These are the 10 things that must go into your occupational health program in order to make it best in class. So you mentioned a couple. You mentioned physician relationships, how it's important to make sure that the physician is informed so that they can make the best decisions in order to have an effective return to work program. And then communication, how it's important for you to get that immediate communication so that you can put them into those light duty positions and in return helping them heal faster. So you mentioned 2 of the top 10. I want to tell you what Concentra did to put their twist on it and to simplify things a little bit more. We took each of those 10 features and we put them into one of the 4 keys that we have. So there are 4 keys here: employer engagement, patient engagement, clear communication, and quality medical outcomes. So it just simplifies the program a little bit more. Employer engagement, again, making sure that we establish processes and procedures to match your injury care processes and procedures to make it easier for you guys to utilize our services. Patient engagement, we want to make sure that we have a focus on the employees. For one, it will help give you the reflection that you care about your employees, but 2, that they get skillful and respectful care. Everyone deserves that. Clear communication, we want to make sure that you get immediate communication in order to manage your cases effectively. And then finally, quality medical outcomes. We want to make sure that we give you the best occupational expertise so that you're dealing with clinicians that understand OSHA recordables, understand your jobs and how to get them back to work quicker. We also have a focus on outcomes. We treat 1 in every 7 injuries. So we want to make sure that we gather all that data in order to have the most effective outcomes that we can possibly give you. So again, in the employer engagement, building physician relationships, what's important to us and you is that we schedule a tour. So I would like to schedule a tour with you in order for our doctors and our physical therapists to come out and really dig into the jobs and understand what they go through so that when we are giving restrictions, they actually relate to the job and we get them back to work quicker. And then when it comes to the structured communication, there's a variety of different things we can use. You will receive a call from the doctor on each initial injury, so that you understand what's going on. It gives you an opportunity to ask the treating physician any questions that you might have related to the injury or the restrictions that we give the individual. You also will get follow-up paperwork by email giving you activity status of what's going on with those employees. And they look like this. They're all typed out. It's giving you time in and time out, diagnosis, typed out restrictions, when we think they're going to get back to maximum medical improvement, and then also when their next appointments are. That way you're completely informed and your employees completely informed and engaged in that treatment plan in order to have the best results possible. So Those two things I know are the most important to you. What I'd like to do now is go ahead and schedule that tour. So if you want to get your calendar out, we can do that. And we can start working with you immediately afterwards. Do you have any questions?